Hello! So today we're going to be talking about infectious diseases. So here I have listed the top 3 most infectious diseases in order of most deadly and prevalent to least deadly and prevalent. Number 1 comes in as pneumonia or flu. Number 2 comes in as HIV or AIDS. And number 3 comes in as tuberculosis, commonly known as TB. So why talk about infectious diseases? The reason we're talking about them now is because we're going to go on to talk about ways to prevent the spread of infectious diseases. So, ways to prevent disease. Number 1, increase research. This is very important. It's very important because with increased research, scientists and doctors alike can come up with better plans of treatment for patients and possibly even a cure for the disease entirely. And the disease itself may go away completely over time. Number 2 is to improve water quality. This is vital because a lot of these diseases are caused by people drinking contaminated water. So if the contamination in the water can be eliminated, then a lot of these diseases will not spread and people will not obtain these diseases the way they do. And number 3, probably the most important for the purpose of this video, would be to reduce the use of antibiotics. So, the key thing here is they are referring to the unnecessary use of antibiotics. If you have a roaring bacterial infection, then yes, by all means, please use antibiotics. But if you have a tiny ear infection and you keep having tiny ear infections, then please do not use antibiotics every single time. So that's what they're referring to here. Don't use it for little tiny things like that. If people can do this and the unnecessary use of antibiotics can be reduced, then you will not be seeing viruses and bacteria becoming antibiotic resistant. When viruses and bacteria become antibiotic resistant, treating those diseases become infinitesimally harder. So, it is very important to reduce the use of antibiotics. So, our next topic is going to be the India case study that we talked about. So, India instituted a population growth reduction program. And they did put it in place, but unfortunately, it didn't work. So the question is, why didn't it work? If they put a program in like this, and they had plenty of money, then why didn't it work? Well, this is why. There is a lack of distribution of birth control and contraceptives. So money was not the issue, it was distribution. This is also similar to why there is an instance of starvation throughout the world. It is not because we do not produce enough food for everyone, it is because it is not distributed properly. So, that is a good association to make. Well, thank you so much for watching. Have a lovely day.